For the last several years, over 2,000 professors, practitioners, and students from around the world descend upon New Haven, Connecticut, and the Yale campus. They're here to attend the world's leading and largest global health and innovation conference organized by Unite for Sight. Social entrepreneurs come to pitch their ideas. Dr. Jeffrey Sachs of the Earth Institute, Seth Goldman of Honest Tea, and Dr. Betsy Bradley of the Yale Global Health Initiative are usually some of the 300 speakers who present lectures and workshops at the conference. But Unite for Sight is more than just a conference. It's an esteemed global nonprofit organization that has provided eye care for more than 1.5 million patients, including more than 60,000 sight-restoring surgeries. And it's the brainchild of a young Yale alumna named Jennifer Staple Clark. And I got a chance to sit down with her to see how it all got started. So we're here in Timothy Dwight College. I guess this is where it all got started then?
Yes, 13 years ago, back in 2000.
Oh, that's amazing. So take us to the entryway when you were here as a student.
I was in entry ID right here.
Oh wow, so this is the Jennifer Staple Clark entryway. I like that. So when you were here and thinking about getting Unite for Sight started, I mean, how did you fit that in with all of the work that you were doing as a student?
Well, I had started it as a small student organization and recruited about 35 students. So we actually went to the Downtown Evening Soup Kitchen, which is right next door to TD, and the New Haven Free Public Library, which is just 2 blocks down, and worked with a lot of community members to connect them with free health coverage programs so that they could receive a complete eye exam by an eye doctor, and then ultimately have been able to provide care to other communities within North America, and then also eventually internationally as well.
So it sounds like the city of New Haven really gave you a base to help create your framework for developing Unite for Sight. Were there other people or mentors along the way who really gave you some great advice in helping you to think through the next steps for Unite for Sight?
Yes, well, as I was developing Unite for Sight here within New Haven, I had some wonderful professors, especially in the anthropology department, who were very, very supportive as I was developing just as a student organization.
So were there any surprises when you first developed Unite for Sight or as it expanded a lot over the years?
I was really very surprised at how quickly it grew. We had about 25 chapters within North American universities within a few months. Thinking back to what I had initially planned and developed, it wasn't quite to the scale that I had envisioned at the time.
So we're here in the headquarters of Unite for Sight, and it looks like I can actually see where it all got started. TD's right out the window.
Yes, TD is right there.
So all of the activity going on in the office is around the 10th anniversary of the Global Health and Innovation Conference that is presented annually by Unite for Sight, which is very exciting. So how did the whole conference get started?
We had developed the idea for a conference to exchange ideas across all disciplines of global health and international development and social entrepreneurship. So we started our first conference back in 2004, and we had about 100 participants and just about 5 speakers, and it was a single day. And the conference quickly grew from there. Now we have more than 2,200 participants from all 50 states and 50 countries who come to New Haven each year to attend the annual conference.
Well, Unite for Sight has done so many amazing things, and I know that you have a lot of experience with growing this organization from the ground up. What kind of advice would you give to people who really want to make a positive impact on global health?
I think it's so important to follow one's passion and ideas, and if you have an idea, really follow through with it, and also work with local healthcare professionals and see how best you can support and assist their work to reach patients who would otherwise not be able to access or afford care.